Assalamualaikum doctors. In this video I am discussing communications that is about bone marrow aspirations, and the complaints is like that a child who is suffering recurrent fever, doctor prescribing treatment but child is not improving. So we want to that's why consultant have taken the decision to do bone marrow aspirations. So as usual IRCAP then explain, as you see he has complaints and we want to be sure of what behind all this and assess response to medicine. Procedure, so we want to do bone marrow aspiration. Procedure is that we will use aseptic needle to take a small amount from inside the bone marrow fluid of pelvis called hip bone, iliac crest, after cleaning and putting local numbness cream. Inside this bone there is what we called bone marrow, which is the factory of doing blood cell. So we'll draw a picture of iliac crest, that which factory of blood cell is the bone marrow. So is there any problem in bone marrow or not? That's why we have to take some sample from the bone marrow. Okay. In case of it is biopsy, we'll tell that some tissue or a core of bone marrow in one piece of bone, which marrow, and then check under microscope. So what is the benefit? Benefit is that we will examine the sample under the microscope to find out what is the cause behind his complaints. We may need a sleeping medicine if child is not cooperative. Risk is that if done by done by expert team, they deal with any pain, then apply numbness cream and we give him painkiller after. Bleeding can occur. Again we will be take the procedure, catch bugs, doing it in clean conditions, and failure. Sometimes repeated can need to done. So role player is asking, can doctor by mistakes enter inside the bone? It is done by an expert team and has it done many times before. Is there any alternative? No. We need to know what happens in the factory of the blood cell. Is he going to bleed? We advise to lie on bed and observe for an hour to check he has no more bleeding, and if this happens, usually minor and stop sometimes. What about activities? He can return to his activities and bath and swim in 24 hours. When result released, as soon as it appears, we will inform you. It will take usually 2 weeks. So still the parents is refused. Arrange another meeting with the consultant, but sooner is better for starting treatment early. Then we do tell the summary leaflet and support group. If she take any blood thinning medicine, we will stop. Okay. So if it is leukemia, mother is very much concerned, asking you, will he die? Until now, we still suspected the conditions. We are not sure. Even if she has leukemia, curable rate is very high. So this is all about bone marrow aspiration for leukemia. Thank you.